Hey all, Claire Marie here with Steve Bradley. Um, Checking our kind of rebooting the blue again, back up and running this week. So Steve, welcome. This is our second rebooting the blue and your first time on. So if you could just do a quick intro to folks of who you are and what you do, that'd be awesome.
Sure. My name is Steve Bradley. I am a licensed professional counselor, and I'm licensed both in Oregon and Washington. I've been working in mental health for just about 20 years. If you figure out my age, you will know that it's my second profession. In my mid-30s, returned to grad school to work specifically in mental health. Um, for the most part, I've worked with Center for Living and was the mental health provider at Norcor. So I've worked on the other side of law enforcement with all the people that have been arrested, detained, and that type of thing. In the mid 2010s, started doing more interest in what law enforcement are doing and understanding their world uh, for a number of different reasons, and was a big advocate of the Crisis Intervention Team Training, or CIT, which Center for Living has hosted several times since 2017. And in that process, found the law enforcement mental health world something more that I was interested in and wanted to engage and provide support.
Awesome.
So
Thanks so much, Steve. So we're super lucky to have you and Chris working on our Law Enforcement Mental Health and Wellness Act program. These little workshops that we post once a month are part of that program. If folks want to access more resources through that grant, we have our Mid-Columbia Interagency Wellness Program set up, and that's, really was created out of the grant. And so folks can access Chris or Steve for free as long as they work for one of our 8 covered law enforcement agencies. And then we also have yoga up and running in person and virtually. Of course, there's the Lighthouse Health and Wellness app. Make sure that you get our proper link to download that. It's not just the general one that's available for free in the app. And then we'll just dive into today's topic. A little bit of disclaimer, this isn't medical advice. Neither of us is a medical doctor. So this is just general information, knowledge, education. Hopefully it sparks some thought for you. Maybe you research more. Maybe you reach out to Crave or Steve or Chris. And so today's topic is taking your mental health pulse, for lack of a better term. And so we're just going to dive right in. And Steve, start us off with just defining stress and the different types of stress. And I'll pop in and off with a screen share for you for some slides that Steve's created for us.
well, I'm going to start with the World Health Organization definition of stress, which I think is a suitable and helpful place to start. And as you can see it on the screen, it defines stress as a state of worry or mental tension caused by a difficult situation. Stress is a natural human response that prompts us to address challenges and threats in our lives. Everyone experiences stress to some degree. The way we respond to stress, however, makes a big difference to our overall well-being. I might also add that when you talk about the different types of stresses, there's several different models. The one that we're going to be moving to on the next screen is just one model. So this isn't gospel truth. This is just one way to look at it. So you can go ahead and advance the screen, which you have. Okay. So the 4 types of stress that we're using here is positive, tolerable, toxic, and acute. As many of you well know, there's certainly positive stresses that people experience. These types of stresses are great because they kind of motivate us to do things, accomplish things, overcome challenges, and can actually be very good. I'm certainly, whether it's seeing a challenge of climbing a mountain or seeing a challenge of completing some education or a physical fitness goal, this kind of positive stress can really be helpful.
Mm-hmm.
The second one listed, of course, is tolerable. Sometimes this can be very serious and temporary. And oftentimes one will use their own internal resources to kind of cope.
Mm-hmm.
That can be beneficial and often help us through those times. That could be a work-related stress that uh, arises. In this case, different types of critical incidents or even minor incidents that stress people out in their work, particularly in law enforcement. But it could also be in one's personal life as well. A medical issue with a family member, an accident with a family member,
Mhm.
um, a death or something like that.
Mhm.
We find ways to tolerate, cope with, and work through this. A third type of stress is called toxic stress. Um, it's typically defined as a prolonged activation of the stress response system, which persistently overcomes a person's ability to cope or overcome the threats. Again, this could be work, this could be in one's personal life, it could be medical life, it could be uh, financial in nature. So don't think of it solely as just a work-related stress that could, quote, be toxic. Now, I want to also point out that the use of the word toxic here is not an actual clinical term. It's more descriptive as
Mhm.
opposed to an actual clinical definition.
Mhm.
Okay. And finally, there's acute stress when something happens often too fast, too overwhelming, and the person is unable to uh, cope or deal with that in the moment. And the definition also includes being able to escape or get away.
Mhm.
Uh, these are those critical incidents in life, including work and personal life, that just hit us really hard, really fast. And somebody may or may not have the ability to cope with it in that moment and is usually overwhelmed.
Mhm.
Anybody can experience acute stress at any time in their life when something overwhelms their resources and abilities to cope at any one time.
Mhm. Yeah, and obviously something that's going to be happening, within the work of law enforcement, whether someone's taking calls, dispatch center, whether someone's taking calls on the road, um, answering
And
calls for service, parole and probation, whatever it is, there's definitely the possibility that they can experience all these types of stressors, but especially exposed more to those acute stressors than the average civilian.
exactly. And I would also point out that even within either the civilian population or the law enforcement population, one individual's response to a specific stressor could be very different than another's,
Mhm.
but the individuals can also be different from one incident to another.
Mhm.
Some of those factors, if you're familiar with the adverse childhood experiences scale, there's so many factors that are going into um, somebody's ability to be resilient or deal with stress, uh, really impact their ability to cope in the moment. Uh,
Mhm.
a good example is, you come across somebody who's deceased. Um, Many people can kind of roll with it. It's not that big a deal. But then the next time they may hit something about that deceased person just really triggers them, whether they realize what it is or not. So
Mhm.
just, I guess my point is there's just uh, a lot of variability and even between individuals and individual incidents.
Yeah. I think it's important to note that that word trigger, right, has very much been taken over by pop culture, right? Like everybody's triggered by everything. So when that word for us is going to be more talking about the level of stress activation that someone's experiencing, right? And so it's triggering that acute stress response that someone is experiencing, not just something minor and someone's tossing that word out there, triggered. So
You're right, and thank you for that.
Oh yeah, not all stress is bad. In fact, like human bodies developed to experience and handle stress. So we need that in order to grow and learn how to adapt and those sorts of things. So I love this slide that you have here if you want to kind of
Yep.
tell us.
I know I'm a very visual person, so sometimes seeing what I just read or talked about is more helpful to me as a visual learner. So on the left-hand side of the teal peak performance stress line, you're going to see when we don't have a lot of stress or things pushing us, we sometimes are bored, but as we increase that stress, whether it's good or bad, it increases excitement. Uh, And then you get to, and everybody's a slightly different, you get to that peak performance where we have the right amount of stress at that moment for us, that we are just on our game and we just go.
That flow,
Everything. Go ahead.
that's that flow state, right?
Yeah. Yeah, absolutely. And then it could be too much where we start developing anxiety, or we're starting to feel like, okay, this is overwhelming.
Mhm.
And then we can get to a point where it's actually is overwhelming. Notice it's a scale or a continuum, and so anyone can fall anywhere on this. Um, but this is an excellent visualization of what I just said.
Mhm.
No. And of course, as I've said before, and Claire has also mentioned, stress is normal and it's typical. I like to use the word typical, but it happens to everybody. It happens all across the dimensions of our life, whether it's work, interpersonal, internal, uh, as far as our own thoughts and feelings, but also external in our relationships. It could be professional, it could be spiritual. Yes, I put the word sexual because we could have sexual stress in our relationships with our partners. Uh, Stress can, of course, can be positive, but of course, it can be negative. Um, Negative, of course, sometimes it's subjective, other times it's pretty clear. Car accidents, conflict, critical incidents.
Mhm.
Positive, buying a new house, getting married, starting a new job. Um, all are stressors in life. In fact, some of the biggest stressors in life are getting married, having children, and starting a new job. And we don't necessarily view those as negative, but they're still stressors on our life.
Mhm.
So, and like I said, inherently it's part of our life.
Mhm.
So,
And I think the other thing, just to note about stress, and I was trying to find the link first because I think we linked to it in our, oh, it's going to play it. My to-do list. Um, so there's a great TED Talk on stress. Dr. Mandy, I think her name, no, Dr. McGonnell, I, I think is her name. I'm going to find it and we'll have it in the newsletter that we share with this. But there is also research around the fact that how we think about stress um, influences its impact on our body. So whether we see the actual stress response that we experience as a helpful or a negative thing, right? And so there's actually research around if we're viewing it as a helpful tool, like it's priming me to respond, it's here to help me, while also making sure that we're giving it the outlets that it needs to process everything that's, occurring with that.
mhm.
um, that helps to make sure and buffer that potential negative impact that the physical stress response can have on the body, just by framing or reframing our own mental relationship with the impacts of stress in our body. So,
a, a good kind of test to do that is uh, if somebody were to think about a past event that they found particularly stressful. And when you think about what happened, you might see it in your mind. You might have emotions that start coming up, and you might actually have that physical response. For example, somebody who was in a car accident and it was a particularly stressful moment. The thoughts, the images, the smells, the sights, the sounds go through your mind as part of your memory, and then you start experiencing the emotional component
mhm,
uh, to that memory that may actually start manifesting as a physical response.
mhm,
Queasy stomach, tightening of chest, maybe muscle tension. I even had patients say they can almost have an echo of pain in the area of their body that surfaces when they recall this memory.
mhm,
So, so taking your own wellness pulse, and these are just 5 dimensions to think about.
mhm,
Uh, One is mood, noticing increase or excessive worry or fear, nervousness, sadness, sometimes being teary-eyed, uh, particularly with that increase or excessive.
mhm,
Most people have a good sense of what their normal is. This is something different than what your normal is.
mhm,
Another possibility is rapid mood changes, and of course, the increasing frequency of those changes. Typically, for men, and certainly anyone in law enforcement, irritability and annoyance.
Mhm.
Uh, but men also might experience sadness or anxiety, um, and it might come and go pretty quickly, whether it's an anxiety attack or something like that.
Mhm.
Excessive anger, irritability, frustration, annoyance, aggression, maybe even feelings of low self-esteem. So these are all related to changes in one's mood.
Mhm.
Uh, Another change to keep an eye on or look at is your behaviors. Any unusual sudden increase in appetite,
Mhm.
sleep, sex drive, uh, can be potential signs that maybe something's not quite working well for you.
Mhm.
I like what Kevin Gilmartin talks about. If some of you have read his book, it's when somebody stops doing the things that they used to do, and he calls it the used to do's.
Mhm.
Before I got into law enforcement, quoting him, I used to play golf. Or before I got into law enforcement, I used to uh, socialize with friends at restaurants.
Mhm.
And some of those things that people may stop in the midst of their transition into law enforcement.
Mhm.
Um, Other behaviors, increased tiredness, um, increased use of substances, whether it's caffeine, nicotine, or alcohol,
Mhm.
increased use of phone because people kind of zone out with their phone and do some of that doom scrolling.
Mhm.
Um, or maybe you might notice a decrease in your work performance or efficiency. Or the complete opposite. You start burying your or self-medicating all of those negative feelings and
Mhm.
experiences by workaholism.
Mhm.
Uh, a third dimension is your thoughts. You know, uh, are you finding that your thought life is more negative in tone? Are you
Mhm.
less hopeful? Are you less positive? How's your concentration when you do an activity that you typically do? Are you more easily distracted? This is not an ADHD type of increase in concentration or difficulty concentration. This is beyond, again, what somebody's baseline may be.
Mhm.
Are you having critical thoughts of yourself? I'm not doing a good job. I'm a bad employee. I'm not a good team worker. Um, Negative thoughts about the world, uh,
Mhm.
whether it's the state, the federal government, the world situation, or even just our local community and increase of different types of events that just really start weighing on us.
Mhm.
So, and one toxic thing that I would pay attention to is somebody's self-labeling thoughts that they may have.
Mhm.
I'm a loser. I'm a failure. I'm not good enough.
Mhm.
I failed. Uh, or they might predict or try to predict a bad future for themselves.
Mhm. Absolutely. And then we're going to get into, we've got our sessions all planned out, and we're going to get into dive deeper into those kind of thought distortions. You listed quite a few there that we can label as thought distortions with specific kind of terms associated with them. But it's also getting at a little bit that difference between that fixed mindset that folks are probably going to find themselves in a lot, and that growth mindset, right? And so, it's important that we can say like, oh, I screwed up there, like, and that's not the end of the world, right?
And
That you
it
screwed up, but we're not beating ourselves up for that mistake. Like, well, that sucks. Okay, learned this thing, gonna do it different next time. Versus what you're saying, right? That labeling, like, I suck because of that, which is taking on ownership that like you suck overall and you're never going to do anything good again. Which isn't the case, right? So we'll dive more into that in some upcoming sessions when we have more time to just really dive deep into those thinking distortions.
the last thing I'll say on the on thoughts is uh, when somebody is repetitively marinating their mind in this negativity,
Mhm.
that's where and we don't even pay attention to it. We don't notice it right away.
Mhm.
So,
Oh, and
um,
I'll jump on that because I was going to mention that it's that negativity bias, which we don't have time to dive deep into today, but is in one of our upcoming sessions, I think pretty soon.
mhm.
And I think, I'm sure get into this, but one of the biggest things about everything that's listed here, which, folks can read into, is that once we find ourselves here, I mean, this isn't the end of the world. First, we have to realize that we're in this space in order to choose to not be in this space. Right. But it's going to take work to intervene on these cycles, right? To get out of that negativity bias takes work because those brain pathways, those bridges are really well built and they're nice and strong. And so it's work and it's worth it, but it is, something that you have to do intentionally.
Certainly changing somebody's normal relationships. Are they isolating more? Are they withdrawing? Or are the relationships in decline or uh, finding more and more challenges? Um, Again, these are all just signs and symptoms. It doesn't necessarily mean somebody's overstressed, but the more that you have across the different dimensions start suggesting, okay, the stress is starting to move from being a healthy stress into more of that acute chronic stress to address.
Mhm.
So the last one I would talk about is values. Now, these could be just your personal moral values. These could be religious values or your professional ethics, or even if you're not a religious person, I would consider having you think about doing more investigation of, uh, it'll come back to me. Uh,
Even just personal values, right? I mean, like, I'm not a religious person, but I
yep,
definitely have strong personal values that are
yep,
important to me.
yep. And the term I was looking for is Stoic philosophy.
Ah, okay.
Okay. Stoic philosophy and a lot of our personal values, um, when we're looking at them, evaluating them, uh, they give us hope, they give us drive, they give us purpose, and the real world oftentimes will start to erode them. And if we're not vigilant in any of these, managing any of these dimensions, it can start to erode our sense of self and our competence and confidence interacting in the world around
Mhm.
us.
I love that term that you just used there, vigilant, right? Like it takes work. We have to be aware of what's going on. We have to be paying attention.
Mhm. And that's a great segue to the next slide with like your body. Many people work out, whether they do walking, lifting, running, biking, uh, Brazilian Jiu-Jitsu. There's a lot of different ways to do workout. You also have to exercise your mind.
Mhm.
Okay. And here's just several different possibilities. This is not an all-inclusive list.
Mhm.
There's all kinds of meditation, whether it's religious or non-religious meditation. Uh, the Honest Guys on YouTube is a great one to go to, but they're not the only game in town. Find somebody you like. And
Mhm.
if you do try meditation, give it a couple shots because oftentimes we might try something, say, hey, this doesn't work for me.
Mhm.
But meditation is one of those things you've got to practice a little bit before you get a sense of, okay, this is helpful for me.
Yeah. I really like Headspace. They have a free version of their app. Of course, they have a paid version. Everybody's got a paid version. But they also have a ton of free stuff available on YouTube. And we link to that a lot in the resources that we send out, and they're linked in our newsletters as well. And they're just really accessible, and they go anywhere from 1 minute to 20 plus minutes if you want. And I just love how they break down building the practice. It starts off really, really, really simple and accessible, and it stays simple and accessible, but you build on your practice throughout and you learn new skills. So it's a cool little program.
There's mindfulness. I can certainly train people in that, or you can Google search mindfulness strategies. Therapy, whether it's short or long-term therapy. And a word about that, um, you could even do some therapeutic intervention through the EAP. Um, the reason, and many people are down on the EAP, but I want to give one thing that I think is really good about this. With EAP, you can connect with a therapist, and if you need help, I can make suggestions, and I know Chris can too. You can get connected with a therapist, and with the EAP, it's often a lot sooner than connecting with them for long-term therapy. Um, EAP is meant to be short-term, usually 3 to 5 sessions, and because we already pay into it with our benefits, does most of the time it doesn't cost you anything, just
Mhm.
your time. The EAP pays the therapist. Uh, Many times it's by video, but some of them you can do face to face. So calling your EAP, maybe checking with Chris and myself, who's a good law enforcement savvy and culturally informed therapist, you can connect with some of these EAPs for 3 to 5 sessions just to talk about something that's going on.
Well, and I think too, I think the best place to start is with you and Chris before they even go to EAP, right? Like, so through Lemois, our program, all of the folks employed by our covered agencies can access Chris and Steve for free. And they can connect with you in person, virtually over the phone or Zoom, or another virtual media platform. I know a lot of therapists, I think, use something called Simple Practice, Simply Practice. Anyways, there's a lot of different ways that you can access. And I think Steve and Chris are the best place to start for our people.
And with that being said, it's important people for know it's not a bother for you to call us. Sometimes people think, oh, I don't want to interrupt him because he's having dinner, or he's no longer working for the day, or it's his weekend, or something like that. No, part of our role is to be bothered when we need to be.
Mm-hmm.
And all those avenues that Claire talked about of getting access work just fine.
Yeah. And I love it. Chris always says 2 p.m. or 2 a.m. Just call me. We know, like, if you guys are sleeping, you'll have your phone on do not disturb, so they can call and you'll answer if you're awake. And if you're not, you'll get back to them as soon as you can.
Yep.
And the other great thing is, like, it's completely free to folks in our program. So anybody listening, you don't have to worry about that. If you're in our Lemois program, Chris and Steve build a grant directly. So it's totally free for our law enforcement folks and our I should say people employed by our law enforcement agencies, whether they are civilian or sworn personnel.
So I'll finish this slide just by reminding everybody, exercise your body and your mind, because your mind is where a lot of those emotions emit from, and our thoughts often influence how we feel emotionally and physically. And it's not just a physical exercise that we're doing. You've got to exercise your mind. The important piece here is doing on regular intervals, because just like working out, if you're working out on regular intervals, you're sustaining and maintaining your strength and endurance. It's the same with mental health. If you neglect leg day when you need your legs, it ain't going to be there.
Mm-hmm.
If you neglect your mental health or looking at your values, whether it's religious or Stoic philosophy or your own professional ethics, if you're not thinking about it, talking about it periodically, they start to atrophy.
Mm-hmm. Yeah.
So, and so part of taking your pulse on, your own wellness, hopefully people can see this. I'm sure you can access the slides through the Lemois app and some of the emails. The important thing to think about with this slide is notice because this is a Venn diagram, many of you are familiar with it, and you can clearly see that there's a number of different signs and symptoms that people experience that overlap across 3 different quote mental health illnesses: PTSD, anxiety, and depression. And I point this out in partly to say, try not to diagnose yourself. Let Chris and I help you out with that. But be aware that some of these things may cross over. And if some of you look at this and say, hey, I have ADHD symptoms that look like some of this, you'd be right. And that doesn't necessarily mean that's a bad thing. Some of these you could even say, well, when I work out, I hyperventilate. I break out in a sweat. I might tremble. If I'm working on losing weight because I'm eating healthier, I might start losing weight. That doesn't necessarily mean you have depression. But this is a cluster of signs and symptoms that if the more you start seeing, the more likely there's something that you might need some help with, and to reach out to Chris, myself, EAP, the Lighthouse app, that kind of thing. So this last slide basically is Chris has my number. I want to get that out there. Feel free to call us. That's what we're there for. The particular website that I have listed here, Walk the Talk America, I stumbled across it a couple of years ago. It is a pro Second Amendment website that also is intersecting with the mental health world. And their goal is, how do we support Second Amendment rights and at the same time deal with the mental health crisis? Because with men, the the chief way they take their own life is through firearms.
Mhm.
And this part of the firearm community wants to make a difference and make a dent in that. Uh, so this particular website and the link gives you a series of mental health screening tests that you can take. And they can give you a sense of, okay, maybe I have this. My encouragement is, if you do one of these, don't say, oh, I took the test and I have depression
Mhm.
or I have an addiction. It's actually better to have a conversation because it's a little bit more nuanced and complex.
Mhm.
Uh, but this might give you an idea of, there might be something I ought to talk to somebody about.
Mhm. I've got it pulled up here, Steve. Can you see it?
Yes, I can.
Okay. Yeah, it looks like there's quite a few different kinds of tests. And
These,
click on
these
one
are,
here. Oh, you
yep,
can, yeah, you don't even have to put in like a email or anything.
nope. It's all confidential.
Okay.
Good grief, if you were to go through and select all of those and then and it'll show you the results.
Mhm.
This particular test is um, that you selected is the depression test.
Mhm.
It's the standard test. Some of you may recognize it. It's given often at medical clinics when people come in,
Mhm.
because medical clinics are now screening for depression. So,
Great. We've got a bunch of tests on here, PTSD test. This is yeah, it looks like a great resource and completely anonymous, which is, I think, really important.
yep,
Um,
that's the big reason why I selected this one. Uh, Anonymous. I know Second Amendment rights are important to many people, as well as dealing with mental health crises.
yeah. So, I mean, obviously, I know this doesn't happen for everybody, but folks should be having an annual physical exam, like checking in with a primary care provider, right? And I think, it's probably reasonable to think about reflecting on your mental health at least once a year, if not more frequently, just staying tuned in, right? Go and take some of those screenings, see where you land. Even just having that insight, whether or not you choose to act on it, gives you more data about your experience and how you're coping with life, what your status is. Um, and it's also the opportunity to then, oh, I've got some new information I wasn't really aware of or didn't have a way to conceptualize, and I can go talk to Chris or Steve about it.
And I've actually had people come to me and say, hey, um, my spouse or myself are wondering, how's my mental health? Feel
Mhm.
free to talk to us. We've got the screening tools. We can ask the questions. It doesn't cost you anything.
Mhm.
We'll give you a take of what we think and what we recommend, and you go from there. And as always, it's completely anonymous and HIPAA protected.
Yeah, I
Um,
think it's super important to like drive home for folks. So, any interaction that happens with Chris or Steve is protected, legally protected information by HIPAA. They don't, when they go to bill, the grant project, they don't say who they met with or anything like that. And so that's all protected information within HIPAA. So there's no reason not to reach out to them. They're free and they don't report out anything. They don't share those screening tools. They don't share any of your medical information with anybody, especially with the agencies.
exactly.
So any just final thoughts you want to share with us, Steve, as we kind of wrap up this Take Your Mental Health Pulse session?
The only final thought that I would have is, if you're not sure, have a conversation. Go to the Walk the Talk America website. Take the depression or the PTSD or the anxiety screens, and if they pop up with, okay, you may have something going on, then have a conversation with us. You can also have a conversation with your primary care provider. You could always go to the EAP without going through Chris and myself.
Mhm.
Uh, but you have a lot of avenues. If you're going to take care of your physical health or your financial health or your relationships, don't forget to take care of your mental health too.
Yeah, absolutely. Words of wisdom. Thank you so much, Steve. We're so lucky to have you and Chris. Really appreciate your time, and we will see you on an upcoming Rebooting the Blue.
Excellent, and it's a pleasure to do this.
Thanks.